Welcome to Mile High Living. I'm Sam Boyd. Thanks for joining us today. For over 50 years, Boulder Center for Orthopedics and Spine has been serving patients in Boulder, Broomfield, and the entire Front Range. As the region's most preferred orthopedic practice, they offer the latest in joint replacement and revision techniques in their state-of-the-art facilities. Their doctors are highly trained specialists focusing on and dedicated to delivering orthopedic excellence. So Dr. Erik Bowman joins me now to share more about their practice. Great to have you on the show.
Yeah, thanks for having me.
Of course. Now, you guys have something that's called Fast Path. What is this and kind of when was it created?
Yeah, so Fast Path is a concept that we created, and we've been doing this since 2020, but didn't really have a name, so we created this name to give it a ring and let people know that this is a protocol or a technique that we use at the Boulder Center for Orthopedics. So essentially what it is a fast path to recovery after knee replacements. Knee replacements historically have been very tough on patients, very painful, and a very slow recovery process where beforehand people wouldn't even put weight on it, and now we see patients going outpatient and walking about a couple hours after surgery. So it's just a concept that accelerates the recovery process.
Okay. Well, kind of why was this created? Was there a need to help patients recover in a much faster period of time?
Absolutely, especially here in Colorado where patients are extremely active. Most people live that Colorado lifestyle. They love to hike, they love to bike, ski. All these very active activities are part of their lifestyle. And it's really hard for patients to sit there and say, well, I got to take some time off. So you still need to take time off regardless. You got to let the tissues heal, the surgery heal. But this is a much quicker process than it was traditionally.
Okay, and is there something about Fast Path and this type of protocol that makes it different from maybe other recovery styles that are out there?
Absolutely. So it's an all-encompassing thing. So remember, it's the concept of recovery process, but there's bits and pieces of it that go along that makes it that much better than the traditional way. For one, the surgical technique. So the surgical technique that we employ is called a subvastus or sub-V. Now that's just the technical term. It's been around for a while, but historically it's been very difficult, so most doctors don't incorporate that into their practice. But as techniques have advanced and training has gotten better, we are now experts at this. Essentially what it is instead of cutting through your quadriceps tendon and requiring that to heal and scar tissue can be built up and then it weakens the muscle itself, instead we're actually going underneath the muscle called the vastus muscle. So subvastus going underneath, and simply moving it to the side. So you're not relying on that tendon to heal. So that's going to speed up your recovery, it's going to make you stronger over time, and it's going to improve your outcomes much faster. Also, in addition, we use robotics. Boulder area has been the forefront of Colorado for robotics, and we've really honed in on how we use this, especially in a functional and kinematic alignment, which is just the way our knees are actually made. And so, based off of using this technique, this advanced technique, we can really put those implants in the best way possible and personalize it to the patient. In addition, we have really accelerated our recovery process where traditionally patients would stay in the hospital at least one night, and even just 10 years ago, they would go to a rehab facility. We don't even really do that anymore. It's very rare for that to happen. Over 50% of our patients are now going home the day of surgery, and that's because 4 hours after their surgery, they're up walking. They're going up and down stairs. Everything you need to do to live, you're doing it within 4 hours of your knee replacement, so it's much quicker. Our pain protocols have also changed a lot. Total knee replacement, no matter what, still is a very painful process. But getting that pain down in those first few days is a very important thing because it allows us to move faster and get that range of motion early. So we use pain pumps, so something that will reduce the pain because it continuously releases this medication to reduce the pain. There's brand new medications that are not opiates, so it's less addiction and side effects from those things. It's not that you may not need those, but the amount you need is substantially less. And then finally, our physical therapists. We have world-class physical therapists on the Front Range, and so they understand what these patients are trying to get back to. So we've developed protocols to get them back to doing all those activities that they want to do.
Great. Before we run out of time, just a couple of seconds left. Why do patients of Boulder Center really trust Fast Path?
We've been doing this for over 5 years now. Patients' outcomes have been absolutely wonderful, and that's the best thing, is the patients understand that they've gotten back to all those activities, and because of that they talk to each other and they all expect that. And so now it's more of an expectation as opposed to maybe this will happen for them.
And a reputation that you guys have built.
Exactly.
Wonderful to talk with you. Thank you, doctor.
Thank you.
And to learn more about Dr. Bowman and his specialties, visit bouldercenter.com. That's where you can also find details about the orthopedic care services provided at either one of their Front Range locations in Boulder or Broomfield. To schedule an appointment, call 303-449-2730. And for more on the Fast Path Recovery Protocol, visit them online at bouldercenter.com/fastpath. Boulder Center paid for this segment. Stay with us.